We're not just a healthcare organization. We're an organization that wants to create a sustainable health system, not a healthcare system. We're thinking about prevention strategies. We're thinking about wellness strategies in communities. We're thinking about populations. We're thinking about outstanding science around the study of populations and people.
I found exactly what I wanted at Dartmouth-Hitchcock. It offered me the opportunity to have a great clinical practice, and it also offered me the opportunity to become involved in the community in looking at quality care delivery for our patients.
My view of what GYND-H is that a patient, wherever they go, whether it's at the academic medical center or in a community practice, whether it's seen by a specialist or primary care doctor, will have the same kind of experience around safety, quality, and service.
Even though I'm 90 miles away from Dartmouth-Hitchcock Medical Center, the major academic center up in Lebanon, New Hampshire, I feel like they're in my backyard. I have direct access to all the specialists and subspecialists up there. So if I'm looking at a case that I need a second opinion on, I oftentimes will pick up the phone and call up my friends up in Lebanon and ask them, what do you think about this case? So the patients, even though they might be seen in a community group practice somewhat removed from the major academic center, they benefit from having that specialty and subspecialty care as if it's in their backyard.
There are resources that the tertiary care medical center has that we can share in as a community center, which allows us to provide homegrown, high-quality medical care for all of our patients, even in the smaller communities.
I really feel like everybody's on par with each other, mainly because the specialists understand that we refer to them and it's important for them to have a good relationship with us. And at the same time, we depend on our specialists for their expertise. So it's extremely collegial. I'm actually very, very happy with that here.
Being affiliated with a teaching institution, it's part of what attracted me to this practice. Teaching medical students and residents challenges me to stay on top of my game.
Dartmouth-Hitchcock is run by physicians for the most part, all the way up to the top. My boss is a physician, his boss is a physician, all the way up. So when I'm talking to people about my job and what I need to do my job better, they know what it's like to be a doctor. I'm not talking to someone who's always been an administrator.
They discovered that she had. I like the spirit of camaraderie, that we really work as a team. So everyone is critical and crucial in the delivery of the care, that we do not create barriers or separations between the layers of the team members, that we treat each other with respect.
Well, sounds like you're pretty stable since being...
Well, I think the special thing about working for Dartmouth-Hitchcock is the opportunity for balance. There's a lot of opportunities to seek out your interests. At the same time, I think they're very conscious that doctors are human and that they do encourage family life and activities outside of medicine.
And then there's a stenosis here that I'm a little bit worried about.
We have assets and tools here that few organizations could possibly match. It's not buildings, it's not new devices, it's not technologies, it's the people. When you put the people shoulder to shoulder, Dartmouth-Hitchcock will stand up with any organization in the country.
We looked at many places across the country, but there was no place like Dartmouth. Within the system, you could do academics if you chose to. You could do a blend of academics and teaching. You could just solely be clinical. You could do research and clinical.
My husband Mark and I, who are both physicians, both work here at Dartmouth-Hitchcock. We're both Canadian, and after we had trained at the Hospital for Sick Children in Toronto, we moved down to Philadelphia and worked children's in Philadelphia, and then worked in New Jersey for a period of time. We missed skiing and we missed the outdoors, and we started commuting up to Vermont on weekends to ski. And on one particular Christmas vacation, Mark spotted a job ad at Dartmouth-Hitchcock and got out the map and said, "That's close to here. Let's have a look at this." So he interviewed here, loved the people that he met here, came home enthusiastic and told me about it. And within a few weeks, we decided that this was the move that was right for us.
Nashua is actually very close to many farmers markets. They're very popular, especially on the weekends, to kind of go see what the new produce is and what the new harvest is for the week. So it's very nice. Even though you're in a city, there's also that rural component as well that you could feel if you so choose.
Living in Nashua is great. I love it here. There's a wide diversity, so we have a lot of ethnic backgrounds here. We also have proximity to some of the larger cities like Boston and New York. We're very close to Manchester Airport, so getting from here to anywhere is very easy. And in the fall, we do a lot of hiking and see a lot of the foliage and go up to the mountains. And in the winter, it's mostly outdoor activities with skiing and cross-country and alpine and snowmobiling and things like that.
I love to bike, so my husband and I take off on our bicycles on weekends right in our backyard, and we're in the country.
Manchester is a multicultural and quite diverse city in the state of New Hampshire. Back in the day, Manchester, there was a textile city, and all these giant mills were based on the Merrimack River. So those mills have now turned into places of work, places where people can live, and it's kind of revived the downtown a bit. So what used to be the old typical burnt-out industry town in New England has now become a real vibrant town with new industry and new places to live popping up on the mills. I'm a big fan of the beach. My wife and I both are. Within 45 minutes to an hour, you can be at the New Hampshire beaches, which are Hampton Beach and Rye. The Fisher Cats are a AA affiliate of the Toronto Blue Jays. As most people know, going to a professional sporting event such as the Boston Red Sox, which are the major league team in the area, can be quite expensive, quite difficult to get to. So for a fraction of the cost, you can have professional baseball. And it's a really fun family event at a fraction of the cost that occurs on a nightly basis here in the summertime.
Concord's the state capital and has a nice, vibrant downtown with farmers market on the weekend and some fun, great restaurants downtown. So it's a growing city. It's interesting. There's always new things popping up that we try to take advantage of.
Bennington is very charming. Every day is a new look at the beauty of the landscape. And of course there's the New England charm as well. There's the covered bridges, there are the museums, there are the old cemeteries, anything that you would want that makes you think of New England. There are two colleges in town. There's Bennington College and there's Southern Vermont College. They inject youth into the town, and so they're the students. But there's also cultural activities that we can take advantage of as well. You've got Bennington Potters, which has been here forever and which has a national presence. And every shop that you see downtown seems to have local artist products and paintings, sculptures available. It has a very vibrant arts community as well.
I love living up here. This wasn't a place I ever thought I was going to live. I grew up in a suburb of New York City and went to school in Boston and came up here really on a whim when I came to check out the institution for the first time when I came up for residency. And it's become a wonderful place to live. I still feel like we have the opportunity here to bring kids up as they should be as kids and not fast forward their lives and make them have to deal with so many things that you have to when you're growing up in some of these bigger cities or near some of these bigger cities this day and age. It's an affordable place to bring up your kids. The public schools are fantastic. Having Dartmouth College here, providing cultural activities for them, really provides, I think, a wonderful opportunity for the kids. They're easy accessibility for hiking, wonderful environment to run and train. I've recently gotten interested in running half marathons. Many people come here to start a job, but end up staying here because of how great it is for their family and for the kids.
Change is happening. So this is really a good time to be joining Dartmouth-Hitchcock because we're helping define how that change is going to happen. Our leadership is at the forefront of creating a sustainable health system.
What it really comes down to is just working with many other types of providers. So I get to, learn from them and talk to them.
Being part of an academic center allows you to many times be at the forefront of medicine. There are so many things that you learn and just information you gain from clinical trials that are occurring. There are options you can give your patients when some of the more conventional therapies are not working for them.
We actually are a model for many systems in this country. You will be working in a place that people are looking at around the country and around the world as where healthcare should be going into the future. That's an awfully powerful feeling, to know that we're on the verge of creating something for a nation, not just for a community.
Hi Britt, nice to meet you. I'm Dr. Mike, one of the sleepy doctors. Who's this here with you?
Not only do we really provide the care for the entire region from a primary, secondary, and tertiary standpoint, but we're setting ourselves up from a research standpoint as being the leaders of medicine for the future. So whether it's delivering excellent care day to day or being part of how things are going to change in the future, it's an incredibly exciting experience to be part of a healthcare system that really can deliver everything that we need to, but also have people working on how things are going to be in the future. And to me, that makes Dartmouth-Hitchcock a very exciting place to work.
The whole idea that the hospital has a relationship with the community, trying to get the community as a whole in better health. And that piece is really exciting.
Thank you. Thanks for everything you did.
You're welcome.
We need a system which is going to have lasting effects for generations, and it's going to stick around to take care of the folks who live here. And I like the fact that Dartmouth is forward-thinking. I think they're forward-thinking in the medicine, in the research. I think that they're forward-thinking in making sure that our care is constantly improving. And I think that they're forward-thinking in making this a financially sustainable, viable product for folks to continue using forever.
Everything is here for me. I have the lifestyle that I want, I have the family time that I want, but I have an interesting place to work with great people. And it's nice for me that it's all there, and so that's what really is the one thing, it's that it's everything.